Well, hello everyone, and welcome to this free teaching all about parasites. I'm Dr. Carrie, by the way, and I'm excited to share with you some of the things that I have learned about parasites and their co-infections. So, we're going to talk about the types of parasites discussed in this free learning video and the symptoms that can go along with it, testing for parasites, and treatment plans. So, let's dive into this. So, parasites are very commonly overlooked because, especially if you live in America, a lot of people think, well, I do not live in a third world country, so therefore I don't have parasites. Well, that's not true. We can get parasites from so many different sources, from food, from water, from even breathing the air. We can get parasites. It is the best way to get rid of parasites and to keep them at bay would be to do a detox at least once or twice a year, or you do a maintenance on a full moon after you have detoxed them. So parasites can cause chronic health issues, numerous health issues, as a matter of fact, and they can be misdiagnosed, and dismissed by your doctors. So, a lot of times with testing parasites, your doctor might say, well, let's do a stool sample and let's see if there are any parasites in your stool. The thing to know about stool assessment for parasites is that it is not an accurate diagnosis if you have parasites, because do not only live in the large intestine, where you would only see them in a stool sample if they were in the large intestine and if they were active. Parasites can live in and be lodged in many organs. So a stool sample is not an accurate way of actually seeing if there is a parasite problem. Most commonly with labs, you're going to see a parasite issue in your basic CBC with diff. And a lot of doctors read that CBC with diff a lot differently than possibly your functional medical doctor. So very easy to do, but you can see them in your CBC with differential panel. How common is parasites? So they are more, like I said, they are more prevalent than most realized. 12% of Americans carry the Toxoplasma gondii. That is actually a very common one. The other common one is a tapeworm. Toxins will weaken the defense system, so your defense system being your immune system, and they will make infections worse. How they do that is that when I teach about parasites to many of my patients, I tell them parasites, if you imagine them, they are like a sponge and they will absorb other toxins. So when you are dealing with parasites, you're not only dealing with them, but you are dealing with several different other co-infections. So you have to keep in mind that when you go in and you detox and you drain the body of parasites, you are also dealing with other toxins. All right, what are they? They are organisms that live off a host, your body being a host. They range in size. Some can be very small, and some can be very long. I've actually seen a couple pictures of really long ones from like the neck all the way down to the ground. So they can vary in size. They can invade the blood-brain barrier, the gut, the liver, the lungs, the muscles, even like other organs, adrenal glands, gallbladder, that's very common as well. Again, you want to think about with your lab testing, they're not always going to show up in a stool testing. They might. I'm not saying they never will. They might show up there, but most commonly they're not going to show up in that type of testing. Okay, how do parasites invade our immune system? If you think about the immune system, you're thinking about your gut. Okay, our gut is our immune system. There are many times when we can have different things that will affect our gut, such as we're eating too much sugar. That's going to bring on the parasites. We're not drinking enough water. We're eating the wrong kinds of foods, carbohydrates that break down into sugar. those kinds of things. If we have other infections like candida or fungus and mold, parasites are going to be more drawn to that. They do block organ function when in this slide saying the bile duct, so that goes back to gallbladder, and that is actually very common too, where people having gallbladder issues, a lot of gallbladder issues, that can be the majority of the time a parasite issue that's affecting that bile duct and affecting how the bile is flowing and working properly. Okay, so symptoms, there are so many different symptoms with these, and more than just what's on this slide. So if you think about the digestive system, again, going back to the immune system, you may have some bloating, constipation, diarrhea, possibly you might even have like constipation to diarrhea and changing back and forth. Not able to sleep well at night. That's very common. Fatigue, low energy, feeling like anxious or even moody. That's very, very common with parasites. Brain fog is common. Any kind of skin issues, rashes, eczema, things like that, that can be a parasite component. Even like the skin peeling, that is related to parasites, joint pain, muscle pain, weight loss, weight gain, symptoms being worse at night. That can be true as well, where you're again going back to you're not sleeping as well, or maybe you're waking up in the middle of the night and you can't go back to sleep. You're not waking up in the morning, you're feeling rested, you're still tired when you wake up. Those are very, very common signs that you may have a parasite issue. Parasites being the root cause. This is very common too. They can be the main source for any IBS, Crohn's, any kind of diagnoses of the digestive system, any autoimmune diseases, common with diabetes or Hashis, any kind of autoimmune. It can be very, very common. They do carry mold and Lyme and other viruses and bacteria. I would add to this even heavy metal. So again, they are a sponge, so they will absorb and they will actually like kind of attach like a magnet to these other co-infections. So if you want to think of it that way, especially it can be with any of these things, but I'm thinking about Lyme in general. Like you can't really detox Lyme until you go after the parasite infection as well. And symptoms may take years or weeks to years. Like you may not know that you have this issue until you're just, my gosh, I'm totally just really, really tired. And I haven't felt better since 2 years ago when I was completely stressed out and this traumatic thing happened to me. And yes, stress can trigger your immune system and it can draw in pathogens. So I'm just using that as an example, but you may not notice these symptoms for a while. So many types of parasites can have the small ones like we talked about, the roundworms, the flatworms, the protozoa, the sporozoas, trematodes, trying to think about the rope worms. There's so many different worms from very, very microscopic to medium type ones. Fluke worms look like a little undigested lettuce in the stool, and then you have your long ones. So there's so many different kinds to really look for. Okay, I talked about this a little bit with sugar intake. Food and water, we get them through undercooked meat, sushi that has raw meat, contaminated produce that hasn't been properly washed, pet handling, pets that are infected, soil and surfaces, walking barefoot, even though it's great to walk barefoot to get your grounding effect, you're still, exposing yourself to any kind of parasite exposure. Touching infected objects, not hand washing properly, blood and contact, you could have a transfusion with that, any kind of sexual transmission, that are other ways as well. And I did mention the air, like, okay, if you can get them in the air, probably everybody has a parasite. If you have a heart that's beating, you probably do have an issue with parasites, whether it be small or large. I'm just telling you it is true, okay? I should have warned you about this slide before I went in there. These are some pictures of parasites that some of our own patients have shared with us. So we've got the long ones on the left side, and those are more of the rope worms. You'll see a little bit of a mix here. The white ones, those are a little bit more smaller, microscopic. And then on the far right, somebody actually threw that guy up. So uh, she was feeling a lot better after that thing was gone. So I always tell people better out than in, right? You're going to feel a ton better getting these out. I got ahead of myself, you guys. Diagnosing, I already talked to you about stool testing. It is a pretty inconsistent test. It's not always accurate. I'm not saying that it's not going to show that, but most of the time it's not going to be very accurate. Okay. You can see them basically in that basic CBC with diff panel, depending on the doctor that's looking at your labs, you can see them there. Imaging can also detect larger parasites. DNA testing, that is still developing, but like the slide said, promising. We do run a DNA test in our office, and it runs so many different things. One of the SNPs, I believe, does show if you are more prone to malaria or not, but it's coming. Muscle testing, I'm going to go back here. Muscle testing is what I do in the office. So in the labs, you'll see it in your CBC with diff, right? I told you that. The muscle testing is a great way. Like, I love to pair it with labs because what one doesn't pick up, the other one does, and vice versa. It's a great way to just combine and compare. With muscle testing, you can actually take a vial, each different vial that has a parasite. So your sporozoa vial, and you can test it. You test it to yourself, to the person, and you can see, is this an issue? It's a great way to just figure out if somebody really has a specific parasite, especially if it's logged in an organ, right? Because you really want to know exactly where it is so you can really focus on that organ and get that organ draining and detoxing better. How to treat them. So I've done so many different parasite detoxes in my lifetime. However, CellCore is totally the number one parasite detox program. It is the program that I have found to be the most successful for my own health and for the health of my patients. You will see more parasites in the toilet using these products as compared to any other ones that I have ever used. How this works is you want to properly drain and support your body first. Draining, I mean that as we have drainage pathways. We have the lungs, we have the liver, the bowels, the kidneys, the lymph, and the skin. If these areas aren't draining properly, then when you go in and you do any kind of a detox, whether it's parasites, candida, whatever it is, and in your drainage pathways aren't open, you're really going to feel terrible. You're just going to feel bad. You're going to feel worse than what you did when you started. So how this is set up is we drain all those pathways first. We want those nice and open. We want the bowels moving. We want the kidneys moving. We want the liver working and detoxing phase 1, phase 2. We want the lymph working. And anytime you see anything on the skin, just so you know for sure that you have a drainage problem, because the skin is the last organ that the body will detox through. If your liver and your bowels, your kidneys, whatever other drainage comes before the skin, if that isn't working properly, it's going to come out the skin. Your toxins are going to come out. The number one, if you have a skin issue, you have a drainage issue. So drainage support first. Then we go into the para 1, para 2, the larger parasites, and the para 3, para 4, the smaller parasites. Then we're switching up the binders. We're doing some mitochondrial repair and some gut repair, some immune repair, and some full body systemic repair. That is just a little snippet about parasites and what they do to the body, to our health, and some of the symptoms that you will notice as well. So hopefully that helps you guys. And like I said before, if you have a heartbeat, you probably have a parasite issue, more than likely have a parasite issue. because we are so inundated with so much toxins these days that it's probably an issue for you. The best way that you can really support your body and your health is through draining and detoxing. And by doing this, you're going to be balancing your hormones, you're going to be getting better energy, you're going to be sleeping better, you're going to be feeling like you can actually do what you need to do throughout the day. I was there, I done that. I was at my low with energy and not knowing if I could keep going. After this program, much, much, much better, a total night and day. And I highly recommend working on parasites for everyone. All right, guys, thank you for tuning in, and we will talk to you later.